Hi, it's Lee Brandon here, injury rehab specialist. Now imagine waking up every day and your lower back felt great and you could do whatever you wanted to do without any kind of limitation or restriction. Well, in this series of videos, I'm going to show you how you can do that. Now the first thing you need to do is consider two things. The first thing you need to consider is what kind of lower back injury you have. And then the second thing you need to consider is, okay, so what caused that type of injury in my lower back? Now for most people, lower back pain is very common. Most of the time the back pain goes away pretty quickly, but I'm guessing if you're watching this video, you're someone that's probably suffered from lower back pain for some period of time and possibly received a lot of treatment and still no improvement. Well, the first thing you really need to do is to consider what type of injury you have. Now the common lower back injuries tend to be injuries to the lumbar disc, to the facet joint, a stress fracture called a spondylolysis, or a complete break, which is called a spondylolisthesis. Sacroiliac joint dysfunction is another common one. A muscle strain is quite common, although they generally don't last very long. And in very, very small numbers, and I've never seen one of these in my practice, but an infection of the spine or even a tumour. The most common type of injury is an injury to the lumbar discs. Now, I will go into a lot more detail in the future on each type of injury and what the potential causes are. But just to give you a quick overview, study done by a guy called Norbert Boos in the Netherlands, he did a lot of MRI scans, and what he showed was around 76% of the population that have never had any back injury already have significant damage to their lumbar discs, which means that these people are a significantly increased risk of getting lower back pain through the disc injury. Now what he also showed was 96% of people who already have back pain also have damage to their lumbar discs. So this is something that I also experience in my practice. A very high majority of people who come to me with lower back pain, particularly chronic pain, they often have damage to their lumbar discs. So as I said, that's the first step. You really need to identify what kind of injury you have. Now the way that I do that is through very thorough evaluations. But what I will do is I'll look at each type of injury and the potential causes of each injury, and there are many causes. So if you really want to get to a position where you can wake up every day, your back feels great, you can do whatever you want to do without any limitations or restrictions, and again, imagine what kind of difference that's going to make to your lifestyle. So what you need to make sure you do, subscribe to the Bodycheck YouTube channel, also like the Bodycheck Facebook page, and what I'll be doing is I'll be bringing you more videos with hints and tips to show you how you can achieve that. So I look forward to seeing you soon, and bye for now.